The Naso-Flo Nasopharyngeal Airway Tube Operation Guide. Preparing items: disposable sterilised Naso-Flo Nasopharyngeal Airway tube, lubricant, disposable sterilised gloves, and cotton swab. Check the nasal cavity to see whether the patient has nasal polyps, obvious nasal septum deviation, or other contraindications before inserting. Choose the correct size of the Naso-Flo. Refers to the distance from the tip of the nose to the patient's earlobe. The right depth of the Naso-Flo tip should be 0.5 cm above the epiglottis. Selected diameter should be similar to the patient's little finger, one size smaller as recommended. Normally 7 to 8 mm for males or 6 to 7 mm for females. Lubricate the Naso-Flo. Water-based lubricants are highly recommended. Spray the vasoconstrictors and local anesthetics on the surface of nasal mucosa if necessary. Place the curved side of the Naso-Flo into the nasal cavity facing the hard palate and push it down along with the flat surface of the palate bone. Slowly and gently rotate and push it down until the right depth. Connect O2 port of the Naso-Flo to the oxygen supply. The recommended oxygen flow rate is 2 to 4 litres per minute. Do not exceed 8 litres per minute. Connect the CO2 monitor to monitor the PET CO2. Cautions: the Naso-Flo must be inserted along the lower nasal passage. Keep the insertion direction completely perpendicular to the face. Do not point to the top of the nose for preventing trauma and bleeding. After inserting the Naso-Flo completely, if the patient coughs or resists, it should be retracted 1 to 2 cm. Push it down slowly and gently. If the resistance is met, do not force. Gently rotate the tube until it is free and then push. During the clinical caring, keep the Naso-Flo unobstructed and clean. Timely suction sputum and clean airway for preventing aspiration. The retention time of the Naso-Flo should be no longer than 3 days. Replace with a new one once the 3 days is over. Extubation method. Clean the nasal cavity and oral secretions before extubating. Withdrawal during the expiration prevents aspiration. When resistance is felt, do not force. Apply water-based lubricant around the tube. Rotate and remove it until it is free. Contraindications included: nasal polyps, hemorrhage, tendency in nasal cavity, nasal trauma, nasal malformation and nasal inflammation. Obvious nasal septum deviation and abnormal clotting mechanism. Patients with skull base fracture and cerebrospinal otorhinorrhea. The Naso-Flo is available with a variety of oxygen resources. It can be connected with the oxygen tube, high-flow oxygen therapy device, as well as the screwed pipe of ventilator and anesthesia machine. The Naso-Flo can also be connected with a simple breathing bag. The Naso-Flo product types and sizes.